Let's get right into it. Number 10. The dislocated joint roadside surgeon. You're out hiking with your buddy and they slip and fall. Their shoulder looks weird and they're in pain. You've seen action movies, so you know what to do. Just grab their arm and pop it back in place. It worked for Mel Gibson in Lethal Weapon, but your friend's shoulder isn't like a Lego piece that just needs to snap back together. It's more like trying to parallel park a car while blindfolded. Sure, you might get lucky and slide right in, but chances are you're going to crash into everything around you. When you try to force a dislocated joint back in place, you're playing pin the tail on the donkey with someone's nerves and ligaments. You might permanently damage those tissues. You might pinch nerves that are already irritated. That's like taking a bruised finger and slamming it in a car door. Then there's the ligaments. These aren't rubber bands that just stretch and bounce back. They're more like the cables holding up a bridge. Once you damage them, they're never quite the same. What you should do instead is immobilize the joint. Use whatever you have, a jacket, a backpack strap, anything to keep it stable. Then get them to a doctor who actually knows which way the shoulder is supposed to go. Someone who didn't learn their medical skills from watching Die Hard. Number 9. The blind finger sweep. Someone's choking and your first instinct is to jam your fingers down their throat like you're fishing for the last Pringle in the can. Stop right there. This move, called the blind finger sweep, is about as smart as trying to catch an angry cat in a dark room. A conscious person who's choking is probably going to bite down harder than your dog when you try to take away his favorite toy. When you stick your fingers in there, you might actually push that piece of food further down their throat. It's like trying to unclog a toilet by shoving more stuff down it. You're not helping, you're making it worse. Let them try to cough it out first. Your body knows what it's doing. Coughing is like your throat's built-in emergency ejection system. If they can cough, they can breathe at least a little bit. Only if they can't cough, can't speak, and are turning blue, that's when you break out the Heimlich maneuver. Keep your fingers to yourself, unless you want to turn a choking situation into a choking and bleeding situation. Number 8. The spider bite cut. So you're out camping, and your buddy gets bitten by a spider. Your first instinct is to grab that pocket knife and cut an X over the bite to let the venom out. That's what every movie hero does. Well, you've just turned a spider bite into a much bigger problem. You're creating an open wound that's basically rolling out the red carpet for bacteria. You're in the woods, using a knife that's probably been used to open beef jerky packages and whittle sticks. And now you're doing amateur surgery with it. The venom doesn't just sit there in a neat little pocket waiting to be drained. It's already traveling through your friend's system. Laughing at your little X marks the spot. You've actually given your friend a nasty wound that'll probably scar, increase their risk of infection, and wasted precious time they could have spent getting actual medical help. Clean the area with soap and water. Apply a cold compress to reduce swelling, and get them to a doctor if it's a dangerous spider. The only thing that X-cut method is good for is making your friend look like they survived a tiny pirate attack. And that story isn't nearly as cool when they're explaining why they needed antibiotics for an infected knife wound. Number 7. The sugar rush for diabetics. You're at work, and your diabetic coworker starts acting weird. They're confused, sweaty, and looking like they just binged all seasons of Game of Thrones in one sitting. Your first thought might be, oh no, their blood sugar is high. Quick, hide the candy. Congratulations, you just made things way worse. Not all diabetic emergencies are the same. When a diabetic person is acting strange, 9 times out of 10, their blood sugar is actually too low, not too high. Think of it like your phone battery. When it's at 100%, everything works fine. When it's at 1%, it starts doing weird stuff and then shuts down. That's basically what's happening to your coworker's brain right now. High blood sugar is like having too many apps running. It's bad long term, but it won't make someone pass out in the next 5 minutes. But low blood sugar is an immediate emergency. Without sugar, their brain is literally running out of fuel. If they're conscious and can swallow safely, give them something sugary. Regular soda, juice, or those glucose tablets they probably carry around. Don't give them diet soda. That's like throwing an empty gas can at a stranded car and saying good luck. If they're unconscious or can't swallow safely, don't try to force feed them anything. Call emergency services and let the professionals handle it. Number 6. The seizure pin-down. So you're at the mall, enjoying your pretzel, when someone starts having a seizure. Your first instinct might be to channel your inner WWE wrestler and try to pin them down. Don't do that. During a seizure, a person's muscles are contracting with incredible force. It's like they've suddenly gained superhuman strength. When you try to hold them down, you're basically getting into a wrestling match with someone who can bench press a car, and the seizure isn't going to stop just because you've got their arm pinned. Instead, clear the area around them of anything hard or sharp, turn them on their side if you can do it safely, and time the seizure. If it lasts more than 5 minutes, call 911. Trying to put something in their mouth doesn't help either. That old wives' tale about people swallowing their tongues during seizures is not a thing. Forcing an object into their mouth is a great way to break their teeth or lose a finger. During a seizure, your job isn't to be a human straitjacket, it's to keep them from hitting their head on that nearby trash can. Number 5. The head injury nap. In movies, when someone gets knocked out, their buddy says, just let them sleep it off. That's about as smart as using a fork to fix an electrical outlet. When someone gets a serious bump to the head, letting them drift off to sleep could be a fatal mistake. While they're getting their beauty sleep, their brain could be slowly bleeding. It could be swelling up like a balloon at a kid's party. The difference is, when this balloon pops, it's not just confetti that goes everywhere. Instead of letting them sleep, you need to keep them awake and get them checked out. Watch for these red flags: uneven pupils, confusion about basic stuff like what day it is, or vomiting. Any of these show up, and it's time for the emergency room. Sleeping it off works for bad haircuts and embarrassing karaoke performances, not head injuries. A nap might feel right, but it could turn a bad situation into a "why is everyone wearing black and looking at a box" situation. Number 4. The allergic reaction wait. So you're at a restaurant, eating something that might have touched a peanut. Your throat starts feeling a bit scratchy, but your EpiPen is in your bag, and you're thinking, maybe I should wait and see if it gets worse. Stop right there. That's like seeing smoke in your house and saying, let me wait until I see actual flames before I call 911. Here's the thing about allergic reactions. They're not like a Netflix series that slowly builds up to the climax. They're more like a TikTok that goes from 0 to viral in seconds. People think they should save their EpiPen for when they really need it. That's like keeping your airbag for when you're about to have a really bad crash. The EpiPen isn't some rare magical potion you need to save for a special occasion. I know what you're thinking, but that needle looks scary. You know what's scarier? Not being able to breathe. The correct move is to use that EpiPen at the first sign of serious trouble. Better to feel a bit silly for using it too early than to end up in the ER because you waited too long. And here's a dark little fact. Studies show that about 30% of people who died from severe allergic reactions had their EpiPens with them. They just didn't use them in time. That's like drowning with a life jacket in your backpack. Number 3. The Heatstroke Hangout. You're at the beach, and your friend starts acting weird. They're super confused, not sweating anymore, and their skin is hot and dry. Your first instinct is to get them to sit in the shade with some water. And congratulations, you've just made things way worse. When someone has heat stroke, their body has completely lost its ability to cool itself down. It's like their internal thermostat is broken and stuck on broil. Just sitting in the shade is like trying to cool down an overheating car by parking it under a tree. The engine's still cooking. You need to actively cool them down, and fast. Their body temperature could be hitting 104 degrees Fahrenheit or 40 degrees Celsius or higher. At those temperatures, their organs are literally cooking. Brain damage can start in as little as 30 minutes. First, call emergency services immediately. While waiting, get them into a cold bath if possible. If there's no bath, start spraying them with cold water and fanning them. Put ice packs under their armpits and on their neck. These spots have major blood vessels close to the surface. Someone with heat stroke often fights against treatment because they're confused and disoriented. They might even say they feel cold. Don't believe them. Their brain is literally too hot to think straight. Number 2. The heart attack drive. Your friend Bob is clutching his chest and saying his left arm feels weird. Your first thought is to jump in your Toyota and race to the hospital. This is one of those times when being a hero might actually get someone killed. Your car might have great cup holders and that air freshener that smells like vanilla, but it doesn't have a defibrillator, oxygen tanks, and trained medical professionals. When you call an ambulance, treatment starts the moment they arrive. If your friend's heart decides to take an unexpected vacation during the drive, you'd have to do one-handed CPR while steering through traffic. That's not going to work out well for anyone. Ambulances have these magical flashing lights that make other cars move out of the way. Your hazard lights just make people think you're looking for a parking spot. The EMTs can also call ahead to the hospital, so a medical team is ready and waiting. If you drive up to the ER, you're basically joining a queue like it's Black Friday at Walmart. Call an ambulance and let the professionals handle it. Number 1. The mouth-to-mouth obsession. Someone collapses in front of you. Your brain immediately goes to every TV show you've ever watched. Time for some dramatic mouth-to-mouth action, right? Wrong. Dead wrong. People die because of this mistake. Modern studies show that for adults, hands-only CPR works just as well as traditional CPR with rescue breaths, but people waste precious seconds trying to give rescue breaths. Most people do it wrong anyway. While you're fumbling around trying to open their airway, their brain cells are dying. When someone's heart stops, they've still got about 10 minutes worth of oxygen in their blood. The problem isn't that they need more oxygen. The problem is that the oxygen isn't going anywhere because their heart isn't pumping. When people finally do chest compressions, they're usually way too gentle. They're afraid of hurting the person. The person is technically dead already. You can't make them more dead. You need to push hard, really hard. We're talking about compressing the chest at least 2 inches deep. And yes, you might break some ribs. That's normal. Would you rather explain to someone why their ribs are broken, or have their family ask why you were too gentle to save their life? If an adult collapses and isn't breathing normally, start chest compressions immediately. Push hard and fast in the center of their chest, about 100 to 120 times per minute. You can time your compressions to the beat of Stayin' Alive. That's all for today. I'll be making similar videos in the future. Subscribe to see them.